the largest extent to which Governor DeSantis there has sort of dialed things back a little bit. Let's get a read on this with Dr. Luiza Petre. Doctor, what do you make of this latest development here? More young people that are popping up in these cases, and in the case of Arizona, more than half the latest wave of cases. What's going on?
Yes, Neil, this is not surprising for a few reasons. Number one, these states where are seeing the surge in cases, they reopened maybe too soon. They did not follow the federal guidelines when it comes to 14-day decline in the number of cases. Number two, we had quite a season of parties from celebration, graduation parties from Father's Day and Memorial Day weekend. And the third, those are the states that did not really reinforce the social distancing and wearing the mask. So it's not surprising we're seeing a lag of 2 weeks later, 14 days, when these cases are actually surging. And again, they are still doubling from a week to another, and that's concerning. We don't know where the tip is going to be. Yes, they are hitting a pause right now on reopening, but there's still more to come. This has been baking for a while, and we're still looking to see what's happening in the next 2-3 weeks.
You know, a lot of people worry, Doctor, when they hear reports of more cases discovered. So far, minus Texas, maybe Arizona, hospitalizations, intensive care unit beds are on the rise, the use of them. But we've not seen a dramatic uptick in deaths. And I'm wondering if, because we're better at dealing with this or more effective at dealing with it early, is it your sense that at least the fatality count will not be as severe as some fear, even with these increasing cases?
There are two explanations here. One, Neil, it's too early. We know it takes about 3 to 4 weeks between hospital admissions to tick up and to see the fatality rates. That's number one. And number two, on a good side, we do have better treatment options. We understand better how to treat these patients. We have better understanding how to monitor the ventilators. We have 2 treatments and a third one, like blood thinners, on the pipeline. So we definitely know how to handle these patients better.
All right, Doctor, thank you very, very much for taking the time here. I apologize for the delay in getting to you. You were very kind, to join us here, and I'm encouraged by some of the things you say. It is a little too early to make generic and general statements.